Welcome back. Now, South Africans can from today start registering to be vaccinated for COVID-19. Once healthcare workers have been vaccinated, government will shift focus on people falling into one of four categories. Well, these include essential workers, persons in congregate settings, people over 60 years of age, as well as individuals over 18 years who have comorbidities. Medical doctor and specialist in public policy, that's David Harrison, says that age is the most important factor to prioritize in the vaccine rollout. Well, he joins us now to speak to us all the way from Cape Town. David, thank you so much for your time this morning. I mean, you're raising quite an interesting point that age should be prioritized in this vaccine rollout. Why is that so?
Well, we really have two tasks to achieve over the course of the next year. The first is to stop severe death and disease, or to significantly reduce it, because that's what's compelling government to lock down society, to lock down schools and the economy. That's our first task. And so we've got to focus on those people in our population who are most likely to get very sick from COVID and die from COVID. Our second task over the course of the next year, obviously, is to try and achieve a level of coverage that ultimately will achieve what we call herd immunity and will stop successive waves of infection. But first things first, we've got to try and find a way to reduce severe death and disease. And the best way to do that in an ideal world would be to line up every single person in South Africa in order of their risk, with the highest risk people first and the lowest last. If we were to do that, and if we were to maintain a social distance of 1.5 meters, that queue would snake 3 times around our national road system of 20,000 kilometers, the N1 to N18. And in the first loop of the queue, the first third of the population, almost all of those people would be over the age of 50 because they're at far higher risk of dying or of severe disease than younger people. So that's the logic. Somebody who's age 55 is about 5 times more likely to die from COVID than somebody age 40. By 65, 10 times more likely. By 75, 15 times more likely. So if we want to open our society and if we want to stop death and disease, the best way to do it is to focus on age.
Yeah, that's quite insightful, David. But I wonder, on the other hand, that how do you respond to the argument that there are obviously those younger South Africans with comorbidities, as you've mentioned. Those could include HIV, diabetes, tuberculosis, just to name a few. How would you argue that they should also be prioritized?
Yeah, so again, if we have a look at those comorbidities and we have a look at their risk, so the risk of HIV, the risk of dying if you have HIV, the risk of dying if you have hypertension, that risk is equivalent to somebody 45 years. In other words, that risk is about 2, maybe 3 times higher than somebody who's, say, a healthy 35-year-old. So what I'm saying is that we're not dismissing that comorbidity. But what we are saying, if we're trying to be fair to everybody in the country, we need to understand everybody's risk relative to everybody else. It's not good enough for somebody to say, well, I've got high blood pressure, therefore I need to be put up in the front of the queue, ignoring the fact that there's a 55-year-old who has a higher risk of dying than you do. So we're not saying ignore comorbidities. What we're saying is understand the relative risk of those comorbidities compared to age. And age trumps everything else until the age of 45, except for one thing, and that's diabetes. And people with poorly controlled diabetes have a risk very similar to a 60-year-old. Oh. But because so much of diabetes is related to age, type 2 diabetes, very, very common in people over 60, particularly poorly controlled diabetics. If you vaccinate people over 60, you're also going to vaccinate almost all of those people who are extremely high risk of diabetes and dying.
Well, due to time, we'll leave it there, but thank you so much for providing this insights. David Harrison, of course, joining us on this and more.